insights. Today, physicians, nurses, and healthcare professionals are the soldiers who are at the forefront fighting this pandemic and are under intense pressure and have put themselves at a great risk and their families while performing their duties. This is a sobering time for all of us. There have been physicians and other healthcare workers who have lost their lives taking care of their COVID patients. In time like this, we would like to honor them. We would like to take a brief moment of silence and acknowledge their sacrifice. Thank you all, the physicians and the rest of the audience who have joined us today. Among many challenges are how to ensure safety of healthcare professionals, challenges of treating the patients, coping with immense loss that is associated with this pandemic, and most definitely, the challenges of financial survival. Our medical experts participants are esteemed Dr. Zina Safdar, Pulmonary Critical Care, Associate Professor of Medicine, Houston Methodist, Weill Cornell Medical College, and President of Jinnah Sindh Medical University, alumnus of North America. We have with us Dr. Asim Shah, Professor and Executive Vice Chair of Menninger Department of Psychiatry, Baylor College of Medicine, Houston, Texas. And we are anticipating Dr. Fahad Imam. He is an emergency room physician and UPNA South Central Texas chapter president. Financial changes and their remedies at present are time sensitive. Some of them are forced to close their practices, and the ones practicing have seen enormous changes in providing care. Recognizing the support they need to sustain their financial viability and to understand how, when, and where to apply the enormous information which is available from Federal Health and Human Services to healthcare professionals. To help us out, how to navigate through the time-sensitive information and updates available in regards to the availability, deadlines, loans, the terms and conditions, we have with us the renowned financial experts, Senior Vice President from Wall Street Alliance Group, Mr. Adil Zaman and Sayed Nisha. They specialize in financial planning for physicians. They have been helping their physician clients understand the financial support available to them under CARES Act. They have generously offered to share expertise with us today on a complimentary basis. I have a disclaimer. I do not have any financial or practice relationship with the speakers, and the purpose is in no way to give financial or medical advice. The financial and the medical updates provided is for general informational purposes. Thank you for being with us today. Adil, as we hear, the Health and Human Services disbursed $30 billion relief package yesterday to the healthcare professionals and the hospitals in direct proportion to the Medicare fee-for-service in 2019. Is this a grant or a loan, and who qualifies for that?
Thank you, Dr. Lubna, for having us here today, and it's an honor, and thank you to all the physicians who are on the front lines of this health crisis. We, being financial planners who've dedicated our practice to doing financial planning for physician families, at this time we have decided that we're going to take 3 months and we're going to educate physicians about the various financial support programs made available to them under the CARES Act. Now, this particular program that you asked about, Lubna, is part of a $100 billion relief program that is being made available to healthcare providers. Out of this, $30 billion is being dispersed immediately to Medicare fee-for-service providers. And the way that they are doing this is that if you have received Medicare fee-for-service payments in 2019, in direct proportion to that, you will be getting dispersed this amount. Now, how is it getting dispersed? Typically, if you're getting payments in your bank account through ACH, it will be sent directly to your bank account. If you are getting payments via check, it will be sent to you via check. And they started sending this money out as early as Friday, and we anticipate that in the near future, everyone that is a recipient of Medicare fee-for-service should be receiving this money. Now, this is money that you do not have to pay back, so it can be considered as a grant. It is not a loan.
So Nishad, we hear like what Adil just mentioned, that some of the folks, they have received the payment right away and some are still waiting. So why is that? And can you also tell us about the terms and conditions of this grant?
Yeah, most of the physicians got the payment fairly quickly, but some of them don't have the ACH set up with the CMS or Medicare. So that's why we are seeing some delay in getting the payments. But hopefully, in a week or so, like one client told me that they call HHS and they are saying that about 10 days, since he's not directly linked with ACH with Medicare, it will delay a little bit, but they should be able to get the money in 10 days. Now, there's one terms of condition is here. The money is, you don't have to return it back, but there's one obligation you have. You do have to go on the HHS website from April 13th. There's a link you have to click, and there's some terms of agreements that you have to attest. It's about 10 page. Most of the clients we speak to, they are saying is quite, generally it's understandable. There are obligations like they're not going to charge any COVID-19 patients out-of-pocket expenses, or they're not going to quit Medicare. There are obligations like this. We can email all of you guys the terms and agreement, but it's pretty standard, they're saying. And one more thing, I just want to acknowledge that Adil mentioned the total amounts, about 30 billion get dispersed. So 70 billion, American Medical Association is working with HSS about this. So what about the physicians who are actually in Medicaid? What about them? What about the physicians who are in W-2? So they are working with them, and we'll be on top of it and give you an update if there's any information for them as well.
So what you're saying is this privilege is for physicians who own the practices. Is that right?
Correct. So basically these are for self-employed physicians who actually do Medicare patients.
Okay, so there is a question from the audience. It is Dr. Ehtisham. His question is, those who are being paid by their group owned by the owner physician, how the remaining physician employees get paid, for example, moonlighting services?
That's a good question. So the payment is going to be received in the bank account that you receive the Medicare fee for service, in the group's bank account that typically receives it. And then it'll be the group's decision as to how they want to disperse the funds. That's how it is currently set up.
So the distribution, what you were saying, the distribution of how this money is going to be distributed is up to the group itself?
That is correct, yes.
So what is your advice to the doctor, or what should they should ask their group, or they should inquire about the distribution of the money to the group and have a meeting or something like that?
Yes, go ahead.
So usually we are saying that this is a question where there's a group practice, they receive the money, and the money received under the TIN number of the corporation is coming in. Now, you're going to distribute it, suddenly the money. So one rule of thumb, the clients are talking about this, that during this time, who works certain proportion of hours maybe distribute equally. But this is more of a HR question, how they want to handle it. But it is coming as a one pool in the corporation. But yes, they should have a meeting and discuss with the partners, various doctors, what's the best way to distribute.
I see. So Adil, this question is for you. We have heard a lot about the Paycheck Protection Plan, and who qualifies for the Paycheck Protection Plan, and what are the terms and conditions? I understand that it's a forgivable loan. It's a forgivable loan, right? And it's different from the grant which has already been distributed. So what are the terms and conditions, and who qualifies for this loan?
So Lubna, the Paychecks Protection Program is probably the most relevant and the time-sensitive loan right now, which is available. And we would encourage people for whom this is applicable to apply for it. So if you're a self-employed physician, if you have your own practice, this is for you. And basically what the government is saying is that whatever your payroll is, whatever your average monthly payroll is, you multiply that by 2.5 times, and that is your loan amount. So a simple example, if your average monthly payroll is $20,000, 2.5 times, $50,000 is the loan amount that you are eligible to get. Now, the way that they want you to use this money is that they want you to use at least 75% of it on payroll expenditure. And the other 25%, you can use it on rent, utilities, and mortgage. And as soon as you get the money, there's an 8-week clock that starts. And whatever amount of money that you use during the 8 weeks in the manner that I've just outlined, that amount gets forgiven. So you do not have to pay it back. So as you can imagine, this is a very good loan available for businesses, small businesses, of which a lot of the physicians will qualify, self-employed and their practices. And the idea is for these businesses to be able to keep their doors open for the next 2-3 months, so that when the economy reopens at that time, you can hit the road running.
I have a question for Nishad. Nishad, we talk about paycheck protection, and does it include the physicians' paychecks as well, who take paychecks from their own businesses? And what is the cap? Is there any cap for example, if somebody makes $500,000, is the loan going to be equivalent to $500,000, or what is the cap here?
Yeah, so Paycheck Protection Program, first of all, the way it works is this. First question we have to ask that, are you self-employed? And do you have any employees? So if number one question, you're self-employed and you have employee, there's a deadline. The deadline is April 3rd, it started. Now, if you're self-employed, if you have no employee, all 1099, the deadline just started yesterday. So these are the deadlines we have to remember. Number two, we have to remember where to apply. So as Adil mentioned, that 75% of the money needs to be used for wages. That wages could be paying the doctor himself or herself, or the employees as well. Now, if you have employee or you're solo, either way, you have to go through a bank. So a lot of people making a mistake, okay, go to SBA and apply. No. The way the process works, there needs to be an audit done. That, okay, where did you use the money? The audit will be done by the bank. So that's why you must go through the bank, and ideally, the bank you have a bank account with, like Chase or for example, Bank of America, where you deal business with, this is where you apply online. Now, we highly recommend that you speak to a CPA, because it is not as simple as your payroll 2.5 times. It doesn't work this way. The way it works, that if you make $150,000, for example, like you asked the question, for calculation purpose, the maximum amount you can use is 100,000. You have to divide it by 12. Plus, you actually have to add the health insurance or any retirement benefit as well. You have to subtract the payroll from there. So it's not as simple as it sounds like. So we recommend that you speak to CPA for April 3rd deadline, that get all the payroll information, number one. Number two, get the 941. Number three, get the P&L, everything. And once you actually upload it to the bank, it takes about 10 to 15 days for them to either approve it or deny it. Through the bank is going to happen. Number one.
Okay, so I have